Hi, my name is Dr. Robin Abramczyk, and I'm a holistic biological dentist in Heath, Texas. The name of my practice is Smile Ranch Dentistry, and I would like to share with you today about mercury intoxication. So there's a lot of misinformation out there about mercury intoxication and determining how toxic patients are, how much mercury they have in their body. So quite often patients will go to a doctor who does actually chelation therapy, and they'll do what's called a push test. So what they do is administer chelators to the patient, and then they'll urinate. They measure the amount of mercury that's in the urine. However, this doesn't take into account the different forms in the body, the different forms of mercury, and how they're moved throughout the body and excreted throughout the body. So methyl mercury is a very common form of mercury, and we get that from the consumption of fish. There's also ethyl mercury, and that is from vaccines. Now, ethyl and methyl mercury, they're very mobile. They move around the body very fluidly. They actually cross the blood-brain barrier. They actually convert into inorganic mercury, and inorganic mercury is the bad guy. Inorganic mercury is very sticky. It sticks to proteins, enzymes, and cell membranes. And inorganic mercury can also be absorbed through the dental amalgams, through the corrosive products that come off of the dental amalgams, also through industrial waste, mercury vapors. Again, it's very toxic, very sticky, and it's slow to move out of the body. Now, the way that I recommend that patients be tested is through a test through Quicksilver Scientific. You can actually come to our office for that test, and it is a tri-test. They actually look at hair, blood, and urine. And they start looking at the blood, and they do what's called mercury speciation. And in the blood, there's two forms. It's mostly methyl mercury, again from fish, and then inorganic mercury. There's a small signal for inorganic mercury behind the methyl mercury. So what they do is they compare the amount of methyl mercury that's in your blood to what's in your hair. And if all of the mercury that's in your hair is actually methyl mercury. So they do a comparison between the methyl mercury in your blood to in your hair, and that gives a really good idea on how the patient is mobilizing and excreting the methyl mercury out of the body. Then they also look at the inorganic mercury that's in the blood to the inorganic mercury that comes out of the urine. Now, the reason why a patient, if they were doing a push test, would have low urine mercury is because of two reasons. One would be because of low exposure, or because the patient's kidneys are not working properly. So I actually had this problem. I did the tri-test a little over a year ago, and I had what's called retention toxicity. So I had high blood, low urine. That can be very problematic if these patients are given a push test. It could actually damage the kidneys. So my recommendation is that a patient have a tri-test done to determine how much mercury and how well they're mobilizing it. If there are any kidney issues, those kidneys are nursed back to health, and then detoxification would happen after that. Now, there are three things that are very important to move mercury out of the body. You need glutathione. Glutathione has a special group called a thiol group, and it attaches to mercury. You also need a transferase. The transferase actually moves the mercury off of the protein, and it connects it to the glutathione. Then you have a conglomerate of the glutathione and mercury. You need a transporter that would help to move it out of the body. So those things are really important, and the protocol actually that is formed through Quicksilver Scientific it has all of those things in it so that you can do a proper, safe, natural detoxification of mercury. Now, the big thing now is leaky gut, and people are really trying to learn more about how to nurse their gut back to health, and most of us, whether we're healthy or not, have some form of gut dysbiosis. So what's really interesting, there's been a study done, and it was on rodents, and they actually gave the rodents endotoxin. Endotoxin is a part of bacterial cell membranes, and whenever they gave that to the rodents, they measured their kidney function, and it was a little toxic, a little damaging to the kidneys. And then they also exposed the rodents to mercury separately. That was also a little toxic to the kidneys. However, when they administered both endotoxin and mercury, it was over 8 times as toxic. So it's very important that we take that into consideration whenever we're detoxifying from mercury. Thank you so much for joining us today.